Hi, it's Emily from the Broken Science Initiative. And in my pursuit of helping people understand the difference between good science and bad science, we're going to launch this series that specifically looks at how you can better navigate your own health and the healthcare system sort of at large. I will try my hardest to demystify the stuff that seems to confuse people or overwhelm them. And if you like these, please share them. And if you have an idea for other topics that you would like us to discuss, please let us know. So this video is going to look at medical tests and sort of get into how you know if they're accurate or not. And specifically, I'm going to start talking about two important concepts: sensitivity and specificity. So this can confuse people, but there's some ways to sort of think about it that hopefully will help you remember. Sensitivity is how well a test can correctly detect a condition when it is actually there. It's like a test's ability to catch a true case. So imagine a disease test that's very sensitive. If you have this disease, then this test will always give you a positive result. It rarely misses a case. So high sensitivity means that the test is great at finding real cases. But wait, there's more to consider. So specificity is how well a test can correctly rule out a condition when it is not there. It's like the test is able to avoid mistakenly labeling healthy people as having this condition. So let's say that we have another test that's very specific. If you don't have the disease, you can be quite sure that you're healthy. It's rarely going to give you false positives. So high specificity means that the test is great at correctly identifying when the condition is truly absent. But this is the catch. When a test is super sensitive, it might catch a few false positives, meaning people who are healthy will test positive. And when it's super specific, it might miss some true cases. So people have the disease, but they'll test negative. So in a real life situation, doctors try to look for this sort of sweet spot between these tests. They want a test that's sensitive enough to catch true cases, but also specific enough to avoid calling something positive when it's not. And this helps us make the best decisions for your health based on accurate information. So let's think of some examples. A mammogram is a common test for breast cancer. It's super sensitive, so it's great at finding actual cases, but it's so sensitive that it often finds cases that are not cancer, false positives. This test in particular has led to a lot of unnecessary intervention and stress for women who are told that their mammograms show something that could be cancer, and it turns out not to be. And with breast cancer, there's such a high recommendation for women over a certain age to get mammograms that there is this whole epidemic that we're calling overdiagnosis. And personally, I hate that term. I think it's misleading. If you're diagnosed with something, how can it be overly done? And this is one of those cases where it's a yes or it's a no, but that's the word that we're all using to describe this, so we have to kind of go with it. But this word overdiagnosis is being basically used to describe when a disease is diagnosed and treated when it was not needed for that treatment. And I wish we could just call it overtreatment, since the problem is not really in the diagnosis, but in the treatment of an ailment that didn't require treatment. And with cancer in particular, we know that the treatments are toxic. So it's really important to understand that over-intervention is likely adding to the incidence rates and other health problems unnecessarily in all kinds of patients. So I may do another video on overdiagnosis because it's a really interesting phenomenon, at least to me, but probably to some of you too. So back to our medical test. So a mammogram is very sensitive and will pick up on a lot of things that are not cancer. On the other hand, a specific test, like a pregnancy test, rarely gives false positives. If it says you're pregnant, you're likely pregnant. But it might miss some pregnancies in sort of early stages of pregnancy, which are called false negatives. So medical tests are sort of like detectives or judges, and they're balancing the sensitivity and the specificity to give you the most accurate results possible. But you have to remember that medical tests are about finding this balance to help you and your doctors make the best choices for your health. And it's a balance. Neither one is perfect. And we have this sort of culture that believes that intervention is always better than not intervening, which I would argue is not always best for patients. So understanding the sensitivity and the specificity of specific tests you're being given will hopefully help you to judge the results of each test and weigh the possible outcomes that it finds to sort of chart your own course and determine whether you're going to move forward with, let's say, a biopsy or something else, or if you want to try some other approach to reading that test or redoing the test and seeing if you get a different result. So I hope that the sensitivity, specificity, which almost all tests are given these ratings of both, helps you to understand your own test results a little bit better. Thanks.